Is concierge healthcare only for rich people? What is concierge healthcare anyway? Hi, I'm Dr. Clelia Lima, nurse practitioner, and I'm here to discuss with you something really, really exciting today. So, maybe you have heard about famous artists or politicians, rich people who have concierge doctors. So, like those rich people, they can pay hundreds of thousands of dollars a year to have a personal doctor 24/7, 365. Some of them pay millions of dollars a year to have a doctor exclusively for themselves and their families. So no wonder many people think, well, concierge doc is just for some privileged individuals. However, the last few years, the concept of concierge medicine has expanded to include models that are much more affordable for anybody actually. So some models have you might have heard it with different names. Some of them are concierge healthcare, boutique medicine, retainer based, subscription, membership based, cash only practice, VIP medicine, direct primary care. Sometimes they're used interchangeably. So today I'm going to talk about uh, direct primary care because overall there is no regulation to say, oh, you charge this much and you have to offer this much service. Each one does whatever they want. So we're not going to be taking little details about what means one or the other. So we're going to call direct primary care. So mainly, we're talking about practices that charge monthly or yearly fees for the patients to have a membership, so they have more personalized care. They have more time in their visits with their patients, and the patients have more easy access to their doctor because they can have an appointment usually the same day. So having easy access to the doctor is very valuable. So people pay, and with these new models of primary direct care, it's affordable. So there is value to that. So one of the questions that I see that is very pertinent is, how much is the membership for a direct care practice? So, like I said, they vary a lot in different ways, but usually we're talking about $50 to $300 a month per person. Usually, if you have a family, you have a discount, for the membership for the whole family. But the average is about $50 to $300 a month per person. So the cost for the direct primary care became more affordable due to the technology. So now we have electronic medical records that streamline all the documentation, and we can have different ways to merge records and to actually see better continuity. Another thing that helps practice a lot is the electronic prescription, that we can send prescriptions straight to the pharmacy without having to write the prescription and all the things involved with that. Also, the education part for the patients is very easier and much easier with the how to say, the patient portal has all the educational material. You have videos available, so it's more accessible to the patients, and the doctor doesn't have to be repeating the same thing with so much difficulty. So the electronic and all the technology has helped to streamline and to make the membership more affordable for that. So The way that the direct primary care works, usually the practice don't charge insurance. Some of them do, and they just charge the membership on the top of the insurance for the extra care. But most of them don't deal with insurance. And right there is a big saving for a practice because you don't have to have extra personnel to do coding and billing and all those things that are a lot of paperwork. So right there is a big saving for the practice. So they can keep the patients more. Um, the patients can keep better service because the doctor doesn't have to do the extra care that is not even related to the care. So that's pretty much how it works. So what another question came in is what is covered in the membership? So as we said before, it varies so much how much it costs and what it covers. Usually, the membership covers the yearly wellness visit, it covers basic lab work, it covers maybe 5, 6 acute visits. If you have something acute, you don't have to pay an extra visit. And the most valuable thing, you have access to your doctor. Usually you have their cell number, so you can text, you can have quick calls between visits if you have any questions or any concerns. So that's pretty much what it's more personalized care. So another question that came in: do I need health insurance if I pay a membership for direct primary care? That's a very good question. And it's very important that whoever decides to choose direct care, they understand that this is not an insurance. That's not a health insurance. It covers office visits mostly. It covers, the overall wellness. But if you need to go to hospital, if you need to have specialists referral, if you need to have an MRI, a CAT scan, or the more expensive test is not covered. So it's important that you have a health insurance for the higher tickets. If you don't have health insurance, you still can have a membership on a direct care practice, but you have to be prepared to pay for the extra tests and hospitalization if necessary. So that's very good question. The other question that I got here is it's very interesting, kind of funny. Do doctors make more money with direct care model? That's a very good question. Actually, the research shows that most doctors choose to go on direct care practices because of the level of care they can offer to their patients. The better quality of care the doctor can deliver is one point, and the other point is the better lifestyle the doctor can have too. So it's a win-win situation. The doctor provides better care, and the doctor has better quality of life themselves. Why? Because in a primary care practice that bills insurance, in the regular, overall model out there, practices are overworked because they have to follow the insurance model. So a doctor may have 2,000, 3,000 patients in their panel. They see as much as 40 patients in a day. We're talking about 10, 15 minutes visit. And most of us have experienced that themselves. You wait for weeks, months to have an appointment, and then you go to the appointment, you wait hours sometimes in the waiting room. And finally, when the doctor comes in, he's in so much hurry. In 10 minutes, in 15 minutes, he's in and out, and you don't have any chance to ask the questions you had in your head. You forget everything. So that's not very helpful for the doctor either, because it can get frustrating for the patient and frustrating for the doctor, because he knows he couldn't give the attention he knew the patient needed. So on the direct primary care, the doctor don't have those, thousands of patients in the panel. Usually they have 400 to 600 patients in their panel, and they see like 6 to 10 patients a day. And the visits are usually 30 minutes. Sometimes if the patient needs more, it's even longer. So it's a win-win. The doctor gets more relaxed, takes better care of the patient has better outcomes, and the doctor is happier too. So it's a win-win situation. And actually, some of the research shows that doctors have a high incidence of depression. Personally, I prefer that my doctor is happy and he's satisfied with their practice, that he slept well, he had time to have lunch, and that he's not overworked. So I know he's going to pay more attention to my needs. So I believe you agree with me on that. So to answer the question, properly, usually the doctor don't make more money. They make about the same money by seeing less patient. Quality of care, quality of life, and quality of care. That's a dream doctor. A dream doctor is the one that I can reach and the one that knows me. So recently, my son relocated, and they need to. My son and my daughter-in-law need to find a pediatrician for the little kids, and they had a hard time to find a practice that they would guarantee the doctor seeing their children were the same, was going to be the same one every time, because most practice now, they belong to big corporations. They have so many practitioners, and every time you go, you see somebody different. So paying extra for direct care, it guarantees that you have that continuity, that you see the same doctor, that they know you. So not because of them, my grandchildren, they deserve the best. I think you deserve the best too, right? So each of us should have the right to have a doctor that knows our needs, that knows what we our history, and can know you in a deeper level by name. So paying a little bit extra sometimes is just what we need. Another friend of mine, she had a very difficult experience recently. She needed a healthcare provider, like in a hurry, and her insurance didn't cover for a practice that would guarantee one doctor. So in 3 months, she saw like 4 or 5 primary care, the same practice, but different ones. And she had to repeat the same story over and over again. They didn't have time even to read her records. So it can be very frustrating. So now I would like to talk to you a little bit about Fuel Telehealth, which is our practice, our primary care practice, and we do have primary direct care. But I have something very excited to tell you. You can have your direct primary care with Fuel Telehealth, with all the good things that I just told you and some more I'm going to tell you now, without paying a membership fee. We offer you the concierge care without a membership fee. You don't have to pay extra to have your doctor cell number. You can have your doctor on speed dial. You can have text message between visits. You can access your doctor for questions. Naturally, we're not talking about every time you call, you're going to have an answer right away, but reasonably within a few hours, the same day, you're going to have an answer for your questions. So we offer that to our patients because we want to have that extra mile, but extra care, in the sense that we take care of you, but we care for you as well. We know you by name. We know the continuity of care that you need. So easy access with visits the same day. Sometimes if you call like end of the day. You might have the first visit on the next day, but usually you can get a visit on the same day, and you don't have to be rich or pay lots of money to have access to your doctor. Your doctor knows you, and you get special attention from your doctor, and you have personalized, compassionate, and extraordinary care. I want to make sure that you experience the extra time and attention, because a one-on-one relationship is something that you build up with time, with interest. And I want to make sure that you feel heard, that I'm not just going to be the one telling you what to do, because nobody can tell anybody what to do. A relationship with my patients, I want to make sure that we understand each other, that we trust each other, because whatever you tell me, I know I can build up my diagnosis on what you are telling me. And whatever I tell you, I'm going to take into consideration your lifestyle, your likes, your circumstances, and we're going to make a plan of care together. It's not like one size fits all. It's tailored to your needs. Because if you have children at home and you cannot, do exercise the way that a single person has the time and the energy to do, I will make sure that we make a plan for exercise that include your lifestyle. Because anything that we talk about, it has to fit around your lifestyle, not the other way around. Otherwise, it doesn't work. So that's kind of, the 101 get to know my patients that I like to make sure that you are well taken care of. So if you want to have a visit with me or one of my team members, we have a special going on for limited time. For $39, we're doing a full visit for you. But just pay attention that because it's a discounted visit doesn't mean it's a discounted quality of care. It's the same visit. You want to make sure that we get to know you. And most people tell me, well, that amount is what I pay for the copay of my insurance. And some people have high deductibles and they appreciate that extra discount. So we want to offer that to you. And if you have a HSA or FSA account, you can use that to pay for your visits as well. And if you need to do blood work or any image or any test, you can pay with your health insurance. I order the test for you, and you use your health insurance to pay for the test, or any medication you may need. You may use your health insurance as well. If you don't have health insurance, we have partnership with several agencies that we have very good discount for people that need to pay out of pocket, especially for labs. We have Quest, LabCorp with excellent prices, and usually people say, well, you can make a difference charging, to get, difference on the discount. And usually I don't believe in that, and I prefer to give the full discount to my patients. So you have good prices if you don't have health insurance as well. After you do your test, you can be sure that we have enough time to discuss the results and make a treatment plan for you, with you, like we just said. And if you need to navigate the healthcare system, it can be so complicated, and we will help you with that as well. We'll do like a management care with you, help you with specialists, help you to find places to do follow-ups, and we will navigate with you this complicated maze of healthcare. We can do wellness visits for you as well. We can be your primary care doctor. Even though we do telemedicine, we do a complete healthcare wellness program for you. We have access to Florida shots, and we check your vaccinations. We tell you what is due, when is due your vaccines. We send you to get your vaccinations. We have so many things that we do for wellness and your wellness visit, for the yearly visit, that you're going to be amazed how much we can do telemedicine. And we'll coordinate your care with you. All this convenience you can have from your home, so you don't waste time going, through traffic and waiting in the waiting room for too long, missing work. We can do all of that on the comfort and convenience of your house or anywhere you are. As long as you are in Florida, we can see you, and we'll be happy to have you in our telemedicine office. Also, I'm offering a free meet and greet. Some patients don't understand what is a meet and greet. Meet and greet pretty much is could be doing a telehealth, like we're doing video, could be just a phone call, whatever you feel comfortable, just to get to know you and you get to know me. So I will do this free chat with you so we can discuss your needs and how we can best help you. So we are here for you, and we are very excited that we can offer you the primary direct care via telemedicine, and we're not charging anything extra for that. Now, a little update on the latest on Omicron. COVID is going down in most countries, actually. In the US, we see the cases going down, hospitalization going down. That's all good news. We're very excited to see some light at the end of all these dark times we have been going through. One of the good news I talked to you guys last week is about the new vaccine, Novavax. It's already in the process of approval for the FDA. And for the people that are reluctant to have the mRNA vaccine, like the Moderna and Pfizer, they will have another option, because this vaccine is made with the conventional method, and they use the particles of the viral protein. So that's all very encouraging. Also, those are 2 doses, and they should be available soon. Paxlovid and Molnupiravir are the oral treatment for COVID. They are already available in the pharmacies. More and more, we can find easier access to those medications. So it's still limited, but we can find some. So if you need a consultation and you are in Florida, I'm here for you, and we can prescribe the medication if you qualify for. So next Tuesday, we're going to be here again live for another health tips and some good themes that we're going to have next week. And you keep yourself healthy and strong, because we're getting to the end of this pandemic. Subscribe to my channel, like my videos, share with your friends. We are very excited to be connecting with you every week. Keep moving towards your best self. Be healthy and feel well. Thank you.